Rachel. Eight. Lachlan's here and Pete. Okay, that's good.
All right. So this is my presentation on Alzheimer's disease. Now, just to clarify, I'm a business major, so I don't know any of this like really fancy like medical terminology or anything like that. So if I get this wrong, I apologize. So Alzheimer's is a progressive brain disease that causes brain cells to degenerate and die, and it's also the most common cause of dementia. First of all, Alzheimer's has two types. There's two different types, early onset and late onset. They're pretty similar in what actually happens to the brain, but the differences are early onset occurs in people under age 65, and typically it usually peaks in people in their 40s and 50s, and late onset occurs in people over age 65. Early onset only makes up about 5 to 10% of all Alzheimer's patients, and there's a little bit of variation in symptoms. And in early onset, the typical changes that are affected most are the changes to personality, behavior, and language. And late onset, the most things that are affected are like changes to memory. There are also 7 official stages of Alzheimer's that physicians identify, and that's no impairment, very mild cognitive decline. Those two are the first two, and there is what's considered mild Alzheimer's or early Alzheimer's. And then 3 through 5, which are mild cognitive decline, moderate cognitive decline, and moderately severe cognitive decline, are middle stage Alzheimer's, and then late stage Alzheimer's are severe cognitive decline and very severe cognitive decline. So first of all, what is dementia? Dementia is a general term for the decline in memory, language, and problem-solving skills, and just your overall cognitive health. It's an umbrella term, and dementia makes up about Alzheimer's makes up about 60 to 80% of all dementia patients. So Alzheimer's is by far the highest cause of dementia, but there are also different types. Like you can see, like there's vascular dementia, Lewy body dementia. The risk factors for Alzheimer's disease are also in 2 different categories. You have non-modifiable and modifiable. So non-modifiable are things that you can't really control. You can't control your aging. So if you're age 65 or older, then that's a bigger risk factors for you getting Alzheimer's. And also if you have family history, particularly if you have a parent or more than one sibling, or just if you have siblings or parents that have Alzheimer's, then that's also a risk factor that you can't really change. And the family history is particularly with early onset Alzheimer's. And then the modifiable risk factors that we've identified would be smoking, a sedentary lifestyle, excessive alcohol consumption, air pollution, a traumatic brain injury, lack of formal education, midlife obesity, high blood pressure, and depression, among a couple other ones, but these are the biggest ones. So first, we need to talk about how the brain normally functions. And your brain is composed of tens of billions of neurons, and they're all connected to each other. Your neurons are what is responsible for processing your information. So anytime you get any amount of visual or sensory information, anytime you think, anytime your brain just does anything, it creates it creates nerve impulses, and those are reactions to like what your brain is doing. Whenever you receive information or create memories, the neurons fire at a speed of 270 miles per hour, which means they send electrical and chemical signals to each other to process that information. And if you receive that same information again, or like if you receive the same memory again, if you think about something again, the neurons that processed it before are likely to process it again, which creates a pattern. That's how you memorize things. And so those neurons that process that specific piece of information or that specific piece of memory, they have a stronger connection. So an example would be, if I ask you, have you ever heard of Spider-Man Into the Spider-Verse? Raise your hand.
Heard of it? Yes.
Okay, see, that's more effective than if I just asked you to name all the movies you've ever watched. If I asked you to name all the movies you've ever heard of or all the movies you've ever watched, you kind of be hard pressed to name more than a few in like a couple minutes, unless you really love movies. But when I tell you a specific thing, like if I ask you a specific movie, if you've heard of it, you're able to tell me instantly whether or not you've heard of it, whether or not you've seen it, and then those neurons basically fire again, and you may also think of things that are related to it. So if you've watched it, you may think of specific scenes that you enjoyed. Basically, the neurons that fired before when you first saw it or when you first processed that information are likely the ones that fire again, and they're the ones associated with that specific memory. So now we're getting it into, so that's the normal way a brain works. And now this is the way that an Alzheimer's starts to develop. So, you know, we all know that there are a lot of chromosomes in our body, and the 21st chromosome in our body is the one that holds the instructions to construct a protein called amyloid precursor protein. That protein is concentrated in the synapses of neurons, and that helps in neural growth and repair. So this protein is usually broken down by an enzyme called alpha secretase. And then sometimes it's broken down by another enzyme called beta secretase. Both are then further broken down by another enzyme called gamma secretase, but the one that we're going to focus on is beta secretase. So after being broken down by beta secretase, what's left is a protein called amyloid beta. We don't actually know exactly what amyloid beta's job in our body is. Our body makes it intentionally, but we don't exactly know why. But what we do know is that if too much is present, or if not enough is cleared away, then that amyloid beta gets really sticky, and they form into clumps called oligomers. And these oligomers can stick to other oligomers and form plaques, basically just these big chunks of amyloid beta. These plaques interfere with the normal process of neurons firing. Essentially, they just get in the way. So we see in brains of all Alzheimer's patients, we see an excess amount of plaques, and that leads to cell death and So another protein is called tau protein, and it's also involved in the brain. Tau protein helps regulate transport of nutrients in the brain and serves as part of the structure that connects neurons together. So if you look back, you can see that the neurons have like these bridges over here. So that's where you would find tau protein. Tau protein, in Alzheimer's patients, what happens is tau protein also becomes sticky, kind of like amyloid beta, and they stick together and they form tangles. These bridges between neurons get really tangled up, and they disrupt the normal transport system and become toxic, and that eventually leads to the death of neural cells. But plaques typically appear before tangles. So that's the physiological reason why Alzheimer's dementia happens. Well, we don't exactly know why it happens, but we know that this does happen. That basically Alzheimer's, in Alzheimer's brains, there are a lot of tangles and a lot of plaques, and those interfere with neurons and eventually cause those neurons to die. So the neurons that hold your memories and your thoughts, and the ones that previously held patterns, like patterns of thought, they begin to die, so that has consequences. Although the buildup of plaques and tangles are found in all Alzheimer's patients, it does not necessarily directly correlate to brain degeneration. There are people who have plaques in their brains who do not have Alzheimer's, and the more plaques in one's brain does not necessarily mean that the Alzheimer's is worse. The connection of the plaques and tangles are still being researched today. What we do know is that Alzheimer's begins long before the first noticeable symptoms arise, and sometimes even 2 decades before diagnosis. And that stage before symptoms begin is called preclinical Alzheimer's disease. So this is it's the stage before you have any symptoms, and like I said earlier, it can start like 2 decades before you're ever diagnosed, but like a long time. It's difficult to diagnose because, well, there are no symptoms. Diagnosis comes from invasive or expensive procedures like lumbar punctures or PET scans and extensive blood tests. So diagnosis at this stage is extremely rare, And you're not really going to go to the doctor unless you actually have something wrong with you or you feel like something's wrong with you. So it's pretty rare to diagnose it at this stage. But diagnosis at this stage may prove critical for further research and development of advanced treatment, because if we can catch it early, then we can begin to understand more of why maybe it's happening or how it starts. So now let's get into some of the symptoms of Alzheimer's. So like I said earlier, we have 7 stages of Alzheimer's, and those are early to mid-stage to late stage. So the more early to early mid-stage would be disruptive memory loss, poor judgment, which leads to bad decision making, especially with money and finances, repeating questions, loss of initiative, losing or misplacing things in odd places, mood and personality changes, including increased anxiety and aggression, taking longer to complete daily tasks, and losing tracks of dates and locations. So a lot of the time, especially for older people who are over the age of 65, this can also just be seen as, well, they're aging, so you might not catch it super early on. You might just think that, well, they're just forgetful or they're just getting older. The moderate symptoms, which would be the middle stage that we're starting to get more severe, would be increased confusion and memory loss, like forgetting your personal history, social withdrawal, inability to learn new things, shortened attention span, changing sleep patterns, which could be sleeping more during the day or being restless at night, inappropriate emotional outbursts, hallucinations, delusions, paranoia, inappropriate and impulsive behavior such as undressing in public or inappropriate language, repetitive actions, and wandering. And wandering is basically like you're kind of just aimlessly walking away, like you're wandering. So now the severe symptoms would be at the late stage, and that would be where a patient is completely reliant on a caregiver for all their daily needs. That would be the inability to communicate, a lack of awareness, groaning, moaning, and grunting, weight loss and lack of interest in food and eating, seizures, and loss of bowel and bladder control. And this is where I want to touch on a little bit of a phenomenon that happens sometimes in a lot of dementia patients and Alzheimer's patients near the end of life. So we don't know why it happens, but it's called paradoxical lucidity. And that's basically when a patient with severe and late stage dementia will have a temporary bout of clarity. And these can appear as the ability to suddenly recall past memories or being meaningfully aware of their situation and being able to communicate better with their caregiver. So I recall seeing an example where one woman told her caregiver, her husband, that she's scared and that she wants him to come with her. So she's more meaningfully aware than she used to be. But that doesn't always happen, and it usually happens very near the end of life. So let's touch a little bit on the patient perspective. Patients with Alzheimer's typically live for 8 to 10 years after diagnosis, but it could be as long as 20 or as short as 4. It really depends on when it's diagnosed and how it's treated. Patients often have an inability to communicate their needs, wishes, or understanding, and they often feel confused, vulnerable, and paranoid. They don't know what's going on, and things happen around them, and they feel afraid, confused, and in the dark. They also often experience a feeling of loss of self. They can often refuse treatment because they don't exactly understand the necessity behind it or why they're getting treatment, why they need it. Basically, just all around confusion. Just imagine being in the dark all the time. So, a little bit on the physician's perspective and treatment. First and foremost, there is no cure for Alzheimer's. None of these treatments can reverse Alzheimer's disease. All they can really do is slow progression to varying extents. So, how a physician would go to diagnose Alzheimer's is they would test for biomarkers through things like MRIs, CTs, and PET scans of the brain to identify plaques, and also using a lumbar puncture to test the cerebrospinal fluid to identify abnormal amounts of the tau and amyloid proteins. If you have an abnormal amounts of those, then that's more likely a giveaway that it's clumping and you're getting plaques and tangles, and you might be suffering from Alzheimer's. But most physicians will also just begin with a basic physical exam and also ask about, your risk factors and family history, of course. And the treatment, all of the treatment really is designed to slow progression because there is no cure. We can't really, for now, we can't really take out plaques or just reverse the damage that it's done. But we have medicines like cholinesterase inhibitors that boost cell-to-cell communication by preserving a chemical messenger called which is usually depleted by Alzheimer's disease. And you can expect modest improvement to behavior like agitation and depression, but it also has side effects like nausea, diarrhea, and if you have certain heart conditions, then that can cause an irregular heartbeat. Another medicine is memantine, which is an NMDA antagonist that slows neurotoxicity by blocking the production of glutamate, but it also doesn't reverse or cure Alzheimer's. Both memantine and the cholinesterase inhibitors can be taken orally, but the inhibitor can also be taken as a skin patch. And then we have some more advanced, some more recent advances that were FDA approved, which is lecanemab and donanemab. Those are IV infusions that you would get 2 to 4 times a week, and they help target and destroy amyloid proteins, getting rid of it before more damages your brain. So the former targets proteins before they clump together, destroying those, and preventing them from clumping together, and then the latter focuses on destroying the ones already clumped together. However, those have some pretty severe risks where you can have brain swelling and brain bleeds, and those can be pretty dangerous. So this is a PET scan, and it shows the the level of brain degeneration, and you can see in a healthy brain there's not a lot of brain degeneration, and then mild cognitive impairment, and then Alzheimer's disease, there's a lot of degeneration. Your brain is literally dying, basically. And now let's talk a little bit about the caregiver's perspective. Now this one is definitely of all diseases in the world, all caregivers have to experience a lot of trouble and a lot of heartache, but especially for Alzheimer's, it can be especially difficult because you're essentially experiencing the decay and loss of someone you love before they even die. Like I said, the patients often experience memory loss and changes to personality and mood and everything. So even though your loved one may still be there, it's difficult to actually connect to them as much as you used to, and that can be especially difficult. So as a caregiver, some of your responsibilities can include encouraging your loved ones to do daily tasks and get exercise, helping with daily tasks like errands and cooking and cleaning, overseeing their medical care, driving them to appointments and making sure they get there on time. And some of the more difficult ones, the more serious ones, would be managing your loved one's finances and legal obligations, and making necessary precautions to ensure that either their house and eventually maybe your house is safe for them to live in. Although being a caregiver can be rewarding, many caregivers are at risk of their own sets of issues like burnout, stress, anxiety, depression, a loss of self-identity, and especially negative self-esteem. And we'll touch a little bit more on caregivers' perspective on Thursday in the discussion. Now I want to share a little bit of stories to kind of lighten the mood. So these are all stories about patients with Alzheimer's. So the first one is about Michael O'Reilly and Linda Feldman, and they're a married couple. Michael has Alzheimer's and unfortunately doesn't always remember who Linda is when she comes to see him. Nevertheless, every time she comes to see him in his care home, he falls back in love with her, and he even asked her to marry him again, even not knowing that they were already married. And they held a second wedding, and although maybe Michael would not be able to recall it anymore, Linda can definitely treasure that memory, and it can be a little bit of peace to her, knowing that even though he can't remember her all the time, he's still in love with her. Another one is Adam Kay, a lifelong avid musician, was horrified to learn of his mother Martha's diagnosis. When he was younger, she would always encourage his passion for music and would even sing along to his tunes, and he always enjoyed playing for her. Although her disease has progressed, every time she hears him play, she once again begins to sing, and Adam can see a glimpse of his mom again and know that she's still there. And that's a pretty common thing with Alzheimer's, is Alzheimer's typically begins in the hippocampus part of the brain, which controls memory. So there are other things like your hobbies, like your skills, like singing, drawing, music, things like that, that can kind of bring you back into some awareness. And so we can see that here. And then another one is a man suffering from Alzheimer's, unable to drive or really go anywhere alone anymore, and felt like he lost his independence. This is especially true when you're still more lucid, but you can't go anywhere. You feel like a patient. You've lost your independence. But his daughter brought him a little puppy, and he began to feel a sense of purpose in taking care of Skippy. And the little dog brought so much happiness into the patient's life that it gave him purpose once again, where all seemed lost. Obviously, the situation for like having a pet for a patient with Alzheimer's disease is like much more recommended if they're living with a caregiver and the caregiver can take care of the pet. But I also heard that the caregiver was really grateful for this because it actually gave the caregiver more time, and they didn't feel like they always had to be taking care of the patient. The patient was occupied by the dog, and they felt like the caregiver felt like they could take a break, and overall it boosted morale and everything. So, any questions?
Yeah, a bunch. First, is it correct that late Alzheimer's or late onset Alzheimer's predominates in females?
Yes, it is true.
And by a wide percentage?
Yes, I think it is by a pretty wide percentage. I think like 60 or 70% are females.
Now, is that because women live longer anyway, or is that?
I did see something that said that. I did see something that said that typically women tend to live longer, and that's why they get Alzheimer's disease.
So they're living long enough to get Alzheimer's?
Yes.
Yeah. Well, I remember saying at the beginning of the semester, the benefits of great medical care is now we're dying of stuff people have never heard of because they didn't live long enough to die of it.
Yeah.
So now we're dying of Alzheimer's, and people who died in their 50s would never have gotten it.
Yeah.
Okay. And you talked about educational level and some other. Do you know about the Minnesota nun brain gift?
No, I've not heard of that.
This convent of nuns, I don't know why, just decided that they would all donate their brains for Alzheimer's research.
Mm-hmm.
And so these were, nuns. Some of them were educated, some of them were not, but they lived in a cloister. They were,
Mm-hmm.
in a convent. And when they died, they all donated their brains. And it was wonderful for epidemiological
Mm-hmm.
research. And one of the things they found, and I don't know if you found this in your research, that when you said that the Alzheimer's starts long before you ever notice it,
Mm-hmm.
what they were finding was that there were these women who had pretty moderately severe Alzheimer's and zero symptoms.
Mm-hmm.
How does that? You would think that at some point the brain deteriorates enough that it's got to be obvious.
Yeah, but that's why there are so many unanswered questions about Alzheimer's. What we do know is that all Alzheimer's patients, like, they have plaques and tangles in their brain, but we don't, like, there are other people who have plenty of plaques and tangles, and plaques and tangles, and they don't have any symptoms, and they're perfectly okay. Again, the brain is one of the most, like, mysterious parts of our human body. Like, I think we know more about, like, distant stars and their physics than we know about, the brain that, like, learned about those distant stars. And I do know of a case, this isn't Alzheimer's, but I have heard of a case where a man in France, he had, like, he was just a completely normal guy, like in his 30s or 40s, and they took a scan of his brain for, like, unrelated reasons, but it turns out that 90% of his brain just wasn't even there. Like most of it was cerebrospinal fluid. It was just sitting in the fluid, and he had like 10% the size of what a normal brain was. But he was a completely normal guy. Yeah, he was a completely normal guy.
Yeah, it was Emmanuel Macron.
Yeah, it was a politician.
Yeah, but he was a completely normal guy, and his
Basically
brain
normal.
function was the same as any other person's, really.
Okay.
But
The other thing I wanted to know about is in the same study, the Minnesota nuns
Yeah.
or whatever, one of the things that correlated was that the women who did certain kinds of tasks were less likely to develop the symptoms. And one of them was like fine work, like needlework or like knitting and things like that. That apparently that engages part of the brain that it doesn't delay Alzheimer's, but it keeps it from being so severe.
yeah. So yeah, like I said, the Alzheimer's typically starts in the hippocampus. So there are other areas that can be more unaffected, and like some things that are more repetitive things are preserved. As like I said with neurons, the more that the neurons fire in the same way, the more like stronger that connection is. So I imagine that it's also more difficult to break that connection, or it's more difficult for those neurons to die. So yeah, that's why it's really important if you want to, like, you can't 100% prevent Alzheimer's, but steps you can take to try and limit your risk factors are to like up your brain health, and that means, you know, learning a second language later in life, formal education, things like that. Again, also things like drawing, puzzles, just things that do engage your brain in a specific way and form those connections. That definitely, it certainly doesn't help you get Alzheimer's.
That was something else they talked about, jigsaw puzzles. The nuns that did jigsaw puzzles,
Yeah,
they had far less cognitive impairment.
yeah.
And is that because you're forcing the brain to recognize shapes and colors, and then the physical bit of putting it in a puzzle?
I think it's overall
the
brain
task.
health. I think it's overall brain health, and also yeah, your neurons are just stronger in general. Like the connections between them. You're doing this task, and it helps you a puzzle. It helps you sort, identify. It keeps it basically helps you like solve confusion. Like you have this like mess of things in front of you, and you make sense of it. It literally is like, I guess, plain and simple, like a cure to confusion. You're curing your confusion. So I assume that definitely helps in just overall brain health, and also just strengthening your brain, strengthening those connections between neurons, and that certainly helps. Yes.
So, one thing that I volunteered at a advanced memory care facility, and one of the I think it was a therapist. I don't know exactly what their job title was, but their focus was on how music helps, not just like with the preventing the advancing of late stage dementia or Alzheimer's, but then also regaining of memories.
Yes.
And she saw I think it was a like 60% improvement with like some patients that had came in like not being able to do really anything, remember anything, to fully remembering her name within, I think it was 6 months of entering into the facility. So
What did they do? Like play flute or something?
Probably
well, like
music that they
a
recognize.
lot of these women that were there that she was studying on, or that she was doing the study on, had played piano at some point in their life, and the ones that had played piano, she started out by playing the melodies that they would have recognized from their childhood, or that they would have learned, or the classics, and then slowly introducing them back to the piano. And then, like, whenever I was helping, or whenever I was volunteering at this place, like, there was one of the ladies that couldn't do anything but play the piano, and like it just really helped her, like her memory. Like, she was able to say like a couple of stories from her past that she just could not recall whenever she first came in. And so I was just wondering, like if you saw anything on that, or like why that's happening.
So Alzheimer's is a very mysterious disease. We really don't know exactly, but yeah, it does happen. It is pretty common. Like in the middle story, the mother would she normally would be like pretty out of touch, but then as soon as he started playing songs, she would sing along to them. So, and also in the case of like paradoxical lucidity, patients, they are sometimes able to become lucid and remember past memories that were thought to be forgotten. So we don't really know if those memories are like completely gone or if they're blocked off somehow, but music certainly does help. And I think I saw some research that said the reason why is because that's kind of stored in a different part of the brain, a part that isn't immediately or as severely affected by Alzheimer's. So yeah, things like music, art, those kinds of things, and especially because playing piano and playing an instrument is a learned skill, a lot of that is also stored in your body. So it's kind of maybe more in like a subconscious part of your mind. But we really don't know. Like there's no conclusive answer about that. Alzheimer's is a really very mysterious disease. I did see some research that said that they are starting to do some like tests on mice, and the mice had like some cognitive impairment or something like that, and they were able to restore brain function somehow. And so, but that's only in mice, and mice can't get Alzheimer's, but it was some start. It was a start, and that's definitely a lot of research is being done. Because our population is aging so much. And so quickly, like old people are starting to live longer. The rate that people are being diagnosed with Alzheimer's is growing every year, and I think it's projected by like 2050 or something like that the medical industry is going to have to spend like $1 trillion on Alzheimer's treatments. So every year there are more Alzheimer's patients. I think I saw another statistic that said like in a few years we can expect people to be diagnosed with Alzheimer's every 33 seconds. Like one person diagnosed in the US like every 33 seconds. Or in the world or something.
That's a lot.
Oh, I thought I'm the old guy in the room. I thought you said you're next.
Very much so.
What's your name? I'm no good at names anyway, so I guess I've had Alzheimer's since I was 12. Any other questions? Okay. Let me have your papers. Some of you have already turned them in online, and that's fine.